I'm rolling already.
Good morning. On Monday, the remaining businesses in St. Louis County are currently closed because of a public health order will be allowed to reopen. Examples include casinos, fitness centers, pools, and banquet halls. While the remaining businesses will be allowed to reopen, they will still be required to follow the business guidelines from our County Department of Public Health, which are published on stlcorona.com and will continue to be updated through next week. This includes wearing masks, social distancing, cleaning and disinfecting protocols, and screening employees. The capacity restrictions for all businesses on Monday will be 25%, and 2 weeks from Monday on June 29th, capacity restrictions will increase to 50%. This increase will be for all business sectors, all types. There will no longer be different dates or different guidelines for different businesses. So all businesses will be open at 25% of capacity on Monday, and 2 weeks from Monday, we're planning to increase capacity restrictions to 50%. On June 29th, 2 weeks from Monday, we will no longer limit gatherings to 10 or less. Crowd sizes will be dictated entirely by the capacity of the fire code of each facility. Businesses will be allowed to have tighter restrictions if they choose. The 50% capacity will be the maximum. Examples of gatherings include weddings, or funerals, or reunions. Outside events will not have limits on gatherings. They can continue with social distancing, wearing masks, staying 6 feet apart, but outside events and parks and so forth will not be limited to size limits. Some park pavilions will have restrictions on capacity, and you'll have to follow the guidelines of each park if you're planning an event that includes a park pavilion. Gatherings of any size still bring with it a certain amount of risk, and it's important that we do respect public health orders, wearing a mask, and social distancing. These are important steps that always must be taken to protect everyone who's at an event. Other special events, concerts and art fairs, and those sort of events will need to have their plans approved by the St. Louis County Department of Public Health, and we are in the process of approving individual guidelines based on larger specific events. We're here today to be able to continue this slow and cautious and thoughtful reopening because of the decisions that have been made by the vast majority of residents in St. Louis County following our public health orders, following our social distancing guidelines, and wearing a mask. Our stay-at-home orders were one of the first in the country. We believe that we were able to limit the impact on our hospitals. We were able to prevent overwhelming our health systems. We were able to limit the impact and the spread of the virus in our community, and we were able to limit the loss of life that we saw in our county and that we continue to see across the country. I want to urge everyone to continue with this responsible behavior that's allowed us to get to where we are today. We have to be diligent. We have to continue to follow our public health orders, our social distancing guidelines, and wearing a mask in our community. As we look at the data from our pandemic task force, we see that hospital admissions continue to decline. ICU admissions are declining, ventilator usage is declining, and the trends are going in the right direction. We also have a much greater ability to test in our community, and we will continue testing and continue testing high-risk individuals, asymptomatic individuals who have frequent exposure to people outside of their home and have increased risk of being someone who is asymptomatic and carrying COVID-19. This testing is important because it allows us to collect data on our community, not only to get individuals treated who need to be treated, but also allows us to collect information and helps us make decisions on further relaxation of public health orders and guidelines for our community. We know that St. Louis County has moved at a different pace than the rest of the state. We have 1/6 of the state population. We have 1/3 of the COVID-19 cases, and a more deliberative approach is required to keep our St. Louis County residents safe. We will continue with a measured pace and a measured response to our COVID-19 epidemic in our community. We will follow the guidance of our public health officials, the Pandemic Task Force recommendations, and recommendations from other medical professionals. When we are able to go beyond 50% capacity in our businesses and our banquet halls and our other facilities will be determined by the continued adoption of safe practices in our community, mask wearing and social distancing. So keep up the good work, and I'd be glad to answer any questions.
Dr. Green, how concerned are you that when you go up to 50%, you're going to see more cases? Is it to be expected? Are you worried about it? What's your take on that issue?
Well, we believe that we've taken a more thoughtful and measured approach here in the community in St. Louis County than we've seen across the country, and that we are better prepared for an increase in cases if we see them. We have better testing in our community than we had 2 or 3 weeks ago. We have extensive contact tracing ability, and if we see an increase in cases, we will manage them. The increase in cases really come from 2 parts in our community. There are people moving about in the community, the traditional community spread, and there are cases that come from congregated living facilities, nursing homes, assisted living facilities, and other places. And we'll be watching those trends. If the increase in cases is isolated to a specific location, those are much easier to manage than if an increase of cases is coming from throughout the community. So we don't just watch the test results and the positive to negative rate and the increase in cases, which we expect over time, but we're watching where they're coming from and making sure we can target our response with contact tracing and any particular institution or business sector.
Was it the hospitalization data that was key for you to ease the restrictions?
Well, we're watching a lot of variables. Hospital capacity is important. Hospital admissions gives us a good measure of what's happening in the community, because we know that the number of cases in the community, a certain percentage of those will end up in the hospital. So that's a good measure of what's happening in the community. Also, our testing is much more available than it was a couple of weeks ago. So we'll watch those testing results. We expect as more testing is available, we will have more positive tests. And then we're watching that positive to negative ratio of tests. How many of the more tests that we're doing, what subset of those are positive? We're seeing about 40 or 45 new cases a day in St. Louis County. That's a significant drop, and we'll watch that number very closely, but we'll also watch how many of those are from a congregated living facility and how many of those are from people that are moving about in the community.
There's been kind of a national storyline about how some states are seeing an increase in the amount of COVID cases, but as it's been said by others, just the increase in cases doesn't really tell the whole story. If there corresponds with an increase in testing and the hospitalization data. So are you basically saying that if we see an increase in cases, it's not necessarily a cause for alarm, it's just a sign of more robust testing, basically?
There are many data points that we will watch. The most important thing to recognize right away is that we'll be following the guidance of our public health professionals, public health officials, medical professionals, and everyone who has extensive experience and expertise in helping us understand these trends. The trends we look for are hospital admissions, new tests, the positive to negative ratio of those tests, where those individuals are coming from, where they're testing positive. But yes, as we do more tests, we will see more positive test results, and that maps into all the other things we have to consider in making a determination about restrictions in our community, recommendations to individuals in our community to stay safe, recommendations to businesses to keep their employees safe and keep their patrons safe. We believe we have a good system in place. We have great communication with our civic leaders, with our business leaders, with individual businesses to provide them with guidance. We're accepting their feedback. We're making modifications in our guidelines based on that feedback, and we have great communication going right now.
Are you expecting to see more cases though in some capacity when you open that up more to 50%?
Well, I think we'll have to watch. I mean, more cases depends on what we have in the community. We have, because of these decisions that we've made, we have suppressed the virus in our community significantly. And we're starting at a much lower spot as we move forward. And we need to be very cautious to make sure that we're doing the right things, social distancing, wearing a mask, and following our guidelines. And we will limit the spread of the virus in our community. We will see some increase in positive cases. There is the potential for it to spread more in our community with these decisions, and we'll be watching it very closely.
I just want to clarify, so no more limits on gatherings to 10 inside. Now it just applies to the 50% as of the 29th.
As of the 29th, limits on gatherings inside will end, and the limits on gatherings inside the building will be 50% of the occupancy.
And then outside, no limits at all.
Outside, no limits, but we still will recommend masks and social distancing, because we know that this virus can spread person to person, whether you're inside or outside, and you need to follow our social distancing guidelines.
And those limits there'll be no limits on outside gatherings on June 29th.
That's right.
Okay. What do you think that the governor's decision to basically lift the statewide stay-at-home order is going to have any effect on the numbers in St. Louis County?
Well, you know, the numbers in St. Louis County depend on how the virus is spreading in St. Louis County among the people that are here, and how the virus is spreading from people who come to visit us. So at some point, if there is more COVID-19 in our state or in our region, and people are visiting us, and we are not following the proper social distancing guidelines to protect ourselves, certainly we could see more in the community. Outside of St. Louis, in more rural areas, certainly social distancing is almost a definition of a more rural community. So that's a variable as well.
Can you give us an idea of what the positive to negative ratio looks like at this point?
Yeah, we track that on our stlcorona.com webpage under the statistics tab. That's reported every day. The number of tests that have been made, the number that are negative and positive, and the ratio, I think it's around 6.5% right now. And we follow that as a weekly trend. That's a very important variable that we're tracking.
Dr. Page, right, I just want to get a clarification. Is there still a limit of 10 to gatherings now, or is it 25% now?
So the 25% on Monday with limits of 10 remaining for gatherings defined as funerals, weddings, reunions, things like that.
Okay, so 25% in businesses.
That's right.
Okay.
And on a week, 2 weeks from Monday, the capacity limits will be at 50% of the building. And if anyone has any questions, they can certainly, specific business guidance related questions, they can email us and contact us through our website. We get lots of communication all the time, and we're working very hard to answer those questions and give our businesses the guidance they need to keep their employees safe and protect their patrons. We've seen wide acceptance of those recommendations in our community. When I travel about the community, the reports, it seems like people have accepted this guidance, and everybody wants to know what they need to do to keep themselves safe. Any other questions?
I have just a couple. So let's shift gears a little bit. We have a question from the call regarding the police department. The specific question is, do you believe there is systemic racism in the St. Louis County Police Department?
Well, you know, I want to back up a second. There's systemic racism in our country. That's a conversation we're having in our country, in our community, and every institution, healthcare, education, and in public safety. And I'm sure that there's systemic racism in our police department as well. The police department is part of our community. It doesn't mean that every interaction between two people is racially charged, but no one could argue that racism doesn't exist in our community. But we have to work past that. We have to work through that. And the conversation we're having now is how we're going to do that. What sort of training is in place? Is that training being followed? We're going to, that's a conversation we're going to have. We are in the middle of a great civil rights debate in our country. And it's a conversation we're going to have today and next week and next month, and we're going to be having this for a long time. But I sent a letter to the Board of Police Commissioners asking them to review all the policies in the police department, and I expect them to do that. I'm looking forward to their response. Our police department follows and has followed the 8 recommendations that we've heard a lot about on use of force. They've been following those, they've had those policies in place since 2010, and we need to be reviewing those policies and making sure they're as tight as possible. If they need to be adjusted, they will. But more importantly, we need to make sure that they're being followed and the proper training's in place.
And a follow-up to that, also from the call, is do you believe the county police department should be defunded?
I don't think we should defund public safety. I think we should have a serious conversation about what is the role and responsibility and duty of a police officer, and whether some of those duties could be accomplished by someone else, whether it's a social worker or a nurse or some sort of community volunteer. But the evolution of the job description of a police officer has changed greatly over the past decade. And there's a lot of challenges in our community that are related to substance abuse, mental health, and you know, those could be better managed. Unfortunately, those have been unfunded, underfunded by state and local and federal government for a long time, and the impact of that has impacted public safety and has made the job of a police officer much more difficult.
Any other questions?
I have one more. Are you concerned at all that what has transpired over the last couple of weeks with these protests is going to result in an influx in cases in St. Louis County, that we're reaching that point, that 14-day point?
Well, we're going to watch that very closely. I've been encouraged from what I've seen of protests in our community that most people are wearing masks. Most people are social distancing, and I think that's important in any outside gathering, as important as it is as an inside gathering. Any crowded activity is a risk, and so we have to have this conversation, and you know, individuals have the right to gather and express their opinion. That's an important part of what's happened in our country over time, and it's going to continue to happen. I really hope that the people involved in these marches and these protests will continue to wear masks, will continue to follow our public health guidelines, and keep themselves safe.
One more question on the defunding the police issue. There was a tangible example of St. Louis County actually increasing funding for the police through Proposition P. But it caused all sorts of ancillary problems by causing other people within county government to ask for raises, and you know, it's arguable that that was put forward not for public safety, but to basically make Steve Stenger look tough. So is it kind of time to maybe re-examine whether that was maybe like come up with a different way of allocating the money from that sales tax and then having voters vote on it?
Well, Proposition P sales tax was for public safety, and 90% of that, 89% of that has gone directly to the police department, almost exclusively, with some exceptions, but almost exclusively to increase the salary for police officers, which was necessary because police officers in St. Louis County weren't paid at a wage that was appropriate and consistent with our community average and what they should have been paid. The other 10% of that Proposition P was divided for other public safety uses in St. Louis County. Some of that was for drug courts, family court, for correctional staff in the justice services, and some of the other services in the jail. It became a great source of controversy over time. Largely was a political controversy that really wasn't driven that much by philosophical differences, but mostly became a hostage of the political climate. I believe we've managed that conversation well. I believe that we're moving forward. We will continue with 90% of that public safety tax going for law enforcement and for the police department. The remaining 10% will be divided among other public safety issues in St. Louis County. But I don't imagine a scenario where we revisit the use of that Proposition P funds beyond what we've already discussed. That's pretty baked into county government. But we will be talking about the services that we're providing, the services people need, how law enforcement interacts with our community, what community policing looks like, and what services need to be provided in conjunction with public safety services that are more comprehensive. That's the debate that's going on in our country, and I expect our community to participate that as well. We have a really good police department, but we have to recognize that we can always be better, and we need to have this process of a deep look inside of our department and make sure we're doing everything possible to keep us moving in the right direction. Any questions? Okay, thank you.